As mask mandates have fallen, there's growing evidence COVID cases are rising. Experts warned the virus would hit back now in pockets of the country.
It's increasing at a rate that we haven't really seen before in the pandemic.
Without widespread testing, experts are analyzing wastewater to gauge how widely COVID is circulating. Tyson Graber focuses on Ottawa, and what he's seeing is not good.
In the next week or so, we're going to see an increase in hospitalizations commensurate with the increase in wastewater signal.
Across Ontario, wastewater analysis shows COVID leveling off through much of February, then steadily picking up again in recent days. Premier Doug Ford was asked whether another surge would mean a return to restrictions.
Let's continue making sure that we move forward in a cautious way. And, let's talk about that if, God forbid, that ever happens at the time.
In Quebec, a subvariant of Omicron is now driving most infections.
There's some room for a new variant like BA2 to sweep across and cause a wave of increased disease.
Just consider what happened at McGill University. With COVID this week striking so many students, the school had nowhere left for those living on campus to isolate.
I would say probably like 30 to 40% of the building is positive right now. That number might have went up since this morning.
And what about those more vulnerable? Kirby Gaiman's father, Clark, was being treated for an unrelated condition in February. He caught COVID in hospital and died.
That's actually pretty scary, knowing that what killed my dad is still out there and still open, and now we know less about it.
There's less testing available now and more decisions left up to each individual, complicating predictions for what happens next. Thomas Dagg, CBC News, Toronto.
Okay, let's bring in Dr. Isaac Bogoch to dive in a little deeper. Dr. Bogoch, how are you feeling about the coming weeks and months with so many provinces essentially going back to normal?
Yeah, I mean, it's pretty clear that when we look at the wastewater surveillance, the Omicron is on the rise, unfortunately, in many parts of Canada. We are going to see a rise in cases. It's hard to quantify because we're not really doing a lot of testing at the community level. And, unfortunately, we're going to see a bump in hospitalizations as well. It's really sad. We all want this to be over, but of course it's not over. I think we still have to be very cautious, especially in the weeks ahead. It's not quite clear how big this wave is going to be, but it is clear that we are going to have a wave.
Okay. And, eventually, as you say, we'll have that wave. But the question becomes, will hospitals and healthcare be able to handle it this time around? What's that tipping point for you? And what can we do to try to mitigate it?
It's not quite clear because we haven't really done anything differently. We still have limited healthcare capacity. We still have, significant challenges with staffing in healthcare. This wave might not be as big as prior waves, but again, there's still a lot of uncertainty in the road that lies ahead. I think we should still be cautious. Obviously, masking is helpful. It's not perfect, but it's helpful. And I think many people are appropriately continuing to mask. And again, if people haven't received dose 1, dose 2, or dose 3 of the vaccine, now is just as good a time as any, and in fact, a perfect time to receive any doses that remain to be received by people that are eligible. So masking, vaccination, and I think we'll get through this like we've got through the last few, but it's just frustrating to see this again happen in the spring.
All right, Dr. Isaac Bogoch, thanks so much.
My pleasure.